Good morning, everybody. Thank you so much today for joining us today for bringing everyone to the table. Family conversations about planning following a dementia diagnosis. Today, our presenter is going to be Dr. Mitchell Gelber, and I will be your host. So, Dr. Mitchell Gelber is a licensed psychologist in Arizona who maintained a private practice in the Prescott area for 37 years. He specializes in adult psychology and has published two books: Alzheimer's Shadow, Families Facing Critical Decisions, and Family Planning for Alzheimer's Disease, Essentials for Best Care. Dr. Gelber contributed a monthly column to the Prescott Courier newspaper and consulted with skilled nursing facilities throughout northern Arizona, providing education and development for staff and direct care for residents. He continues to present at seminars on cognitive impairment and dementias. Dr. Gelber was a founding board member of the Desert Southwest chapter of the Alzheimer's Association. He received his doctorate from the University of Maine. And I will now hand it over to Dr. Gelber.
Thank you. Good morning, everyone, and thanks for attending. And Lauren, especially thanks to you and OC for having me be part of this. This is one saying I heard is inside every older person, there is a younger person wondering what happened. And I know we all feel that way to some degree. Some of us certainly feel it a lot more. Based on the time we have allotted today. Lauren, will you be changing the slides? I'm not sure how to change those slides.
I will, yes, I will change the slides.
Okay, you can put on number 2 then, please. Thank you. I hope you all can see the slides well, and you have access to them post my presentation today. I want to let you know that we have about an hour, and I'll talk a little bit fast, and I won't get into detail about much things, but I want to give a good overview of our topic today. I'm going to ask that you hold your questions for the last 15 minutes so that we can get through things, and then we can have a discussion and Q&A. And I know what brings everybody here today is the discussion around the dementias. And for those of you who are caring for yourself, for those of you who are caring for others, some for maybe months, some for even years, you recognize that the best laid plans often go awry. And each phase or each day sometimes in the dementia process can present unexpected situations and sometimes crises. There's a saying that I have misery likes miserable company. And in that, I mean that is where we can find our most support. We have people who understand, we have support groups, we have family members that may be attentive and or friends that are attentive. But this is a long journey. And the journey requires a roadmap to address all the needs along the way. The who's and the how's and the where's and the when's. These all things have to be addressed as the journey proceeds, because healthcare has changed dramatically over the past 20 years. Medical advances, distances between family members, longevity of life, expectations of family members, and primary care providers even are changing what they offer. So we live longer and perhaps not even happier. We have higher expectations of ourselves and others throughout our lives, and then end up not being able to fulfill those expectations because of the dementias. How do you reconcile the promise that you may have made for yourself or to a loved one when you say, okay, you'll never have to go in a facility or some kind of care home? How do you reconcile that when the care becomes too much or it becomes untenable for you to provide? Remember that safety is first, and what is best for the person you're caring for deserves the priority. There's a Navajo saying that says, if I didn't believe it, I didn't see it. And that goes along with what we observe and feel and believe with the dementias, with denial, with minimization, with making excuses for. If you don't believe it, you're not going to see it. And I want you to hang on to that. Okay. You know, some of the questions I ask myself when I'm doing these kinds of presentations is, and I ask you these things. Has your loved one been accurately diagnosed? Uh, can the person live by themselves or not? Are there increasing medical or behavioral social changes that need to be addressed that are affecting daily life? How about decision making? Is there acceptance or is there denial and minimizing? A person trying to control their life and their conversations and really not doing a good job. For care providers, recognizing your boundaries and the safety of your loved one. It's important to gather information. It's important to discover your resources. Slide 3, please. On this slide, I just wanted to give a brief overview of the effects of dementia. People who have dementia are generally, well, I'll do the first side, is they have psychologically, they're looking for psychological safety. They're looking for dependability because they're not being able to be dependent on themselves. They're looking for structure because their life is becoming more unstructured and limited. They're looking for clarity, even though clarity gets more difficult because of their limited cognition. And they're looking for meaning. As the cognitive process leaves and as the memory fails, meaning becomes more unclear. And basically, what people with the dementias begin to go through is a sense of boredom. And the boredom occurs because they cannot understand much what's going on. There's generally a sense of loneliness, which can lead to depression. And sometimes I've worked with folks that have been very depressed and their dementia is really not severe, or they may have mild cognitive impairment and it's more of a depressiveness that they're going through. That sense of helplessness and hopelessness and fear, a lot of fear as you begin to lose your abilities, whether it be cognitive or your social relationships disappear, those kinds of things occur, you begin to feel more fear. Okay. Let's go to the next slide, please. Again, I'll go through this fairly quickly because I want to make sure that we get to everything and we have time for questions. And because I think one of the main reasons people come to presentations like this is to, number one, feel like and understand they're not alone, and number two, what do you do whens and what ifs. So I want to add some time for that. There's a comment which I'll get to from Julie in a little bit later, and that has to do with not only boredom but apathy. And that's a very good point, Julie, which I'll get to. In this slide, there's a kind of checklist that I think is important to go through the next two slides, and I'll mention all of these pieces here. Number one, again, is to confirm the diagnosis. We know that people who begin to have memory failure begin to misplace things, have difficulty in details, retention, recall, those kinds of issues. Generally, we begin to think, uh-oh, dementia. Well, that's something you do need to address and do need to think about. It's very important to confirm the diagnosis. Many people who are correctly confirmed with a dementia, and let me just say real quickly that some of you probably know this, dementia is not a disease. Dementia is a syndrome. It's a series of symptoms that affect cognition, that affects affect or emotions. It affects relationships, personality, social functioning. And these symptoms, or the dementias, get attached to diseases like Alzheimer's disease or frontotemporal disease or Parkinson's disease or Lewy body disease and many others. There's almost like 80 different disease processes that have dementia-like symptoms. So we want to confirm the diagnosis. The next important piece in this checklist is, who do you share this initial information with? Who do you share it with, and when do you share it? Very important information. Many people are dealing with embarrassment or denial when they first either become diagnosed with mild cognitive impairment or a dementia. So who you share it with is important, because number one is you want the support. Number two is your loved one or yourself are going through daily routines with people. And do not underestimate what people pick up from you in daily conversations, daily interactions that you might have, whether they be at work or at home in social situations. I mean, people with mild cognitive impairment and early dementia are still very functional. And they can operate cars and go about business and do many, many, many things. So who you share with becomes an important ingredient because of future planning. Then becomes to schedule an initial meeting. Scheduling an initial meeting means basically that you are connecting with people to let them know that there has been a change in your medical condition or your loved one's medical condition. I think this is important because it opens up discussion. It takes away embarrassment. It takes away secrecy. It takes away a number of those different kinds of negative response styles that people have. Another important ingredient is to develop an initial plan. Trust me when I say plans change. As some of you already know, your plans, which occurred when maybe the diagnosis was made or when you first started talking to people, changes dramatically as the processes continue. And remember, the dementia process, or the losses that one occurs through the dementias, can take years. So at times you may be living with, taking care of a person who has a dementia, and it could be 10 years, or it could be 2 years, it could be 6 months. Developing an initial plan gets you started. Nothing is in stone. Everything is flexible and changeable. It gets you thinking in a certain way. When I say contact person, which is next, as things progress, if you are a primary care provider, your life is going to be full. For those of you already there and in the early to middle stages of the disease process, you know that your life is getting full. Roles are changing. Your role is changing with everyone. Having a contact person, to me, means having someone you can relate to that can share information with the other folks in your group so that they get the information. You don't have to respond to everyone via email or texting or phone call or any kind of chat that you use. You have a person that's really taking care of that, furthering information. It takes a real load off of you if you have those people available for you. It's also important to gather information and begin to select the professionals that you believe will be necessary with the progression of the disease process. And so that can vary. It depends on the number and types of medical conditions you have, whether you have a hospital system working with you, a dementia clinic working with you, whether you have specialists, neurologists, if there are other medical providers involved, heart specialists, maybe heart specialists, endocrinologists, whoever may be there, psychologists like myself, whoever these people are, it's important to begin to get a selection of people who are knowledgeable in the dementias and can provide information that can help you and further you along. It may be time to set up those meetings with professionals. Who's available? Because you know as well as I do, you cannot make a phone call or a contact and say, okay, can we meet next week? Those things take time. So if you're at the point where you are looking at setting up, begin to take advantage of those situations. Know who they are and begin to think ahead. You'll hear me say this again at the end. Think 6 months to a year ahead. It is urgent that you do that. These situations, the conditions are not going to reverse. They will get worse. They will take more time. They take more energy and focus. And so your times will be more used towards the direct services. So think 6 months to a year ahead and how you would like life to go. It won't always go like that, yet you'll get some indication of what you have to plan for. Something else to do is to provisions and adjustments. Does your loved one remain in the home? Does your loved one go and live with a family member? What happens? What's the plan? Begin to talk to people about this subject matter. Excuse me. Okay. It's important that people have an understanding and update as to where and what and when things are planned for. They will change, I guarantee you. And the last thing on this slide is think about transferring to another level of care. Generally, that's going to happen. If you don't know, I'll give you a moment to guess. The number one reason why a person leaves home or leaves their family home to go to a memory care unit, assisted living, or some other kind of group home arrangement. Can you guess? The answer is the answer is not being able to take care of self-care. Okay, when a person is not able to control their bowels, control their urine, control their personal hygiene care is the number one reason that people generally leave home and family members say, or loved one says it's time. Okay. Can we go to the next slide, please? Okay, and I've just reviewed some of those three, and let's go to the next one. Okay. Practical strategies. Okay. There are a number of practical strategies that can help you in learning more and developing a system for yourself and for those loved ones that you're going to care for and the ones that are going to be assisting. Remember that relationships are going to change. I've worked in this field long enough to hear from people that when they start out and they have an initial group that's very helpful to them, whether it be family members, whether it be people who are close neighbors, social friends for many years, as the disease progresses, people generally do not offer the kinds of help that is going to be needed because it becomes more personal. It's a lot easier to give transportation or prepare meals, or spend some time in your home with your loved one if you have a medical appointment and he's or she's not able to be home. It becomes more difficult when the care becomes more personal and or the behavior or cognition begins to slowly leave. People begin less able to be there. So you begin to rely more on agency help, in-home care, those kinds of things. So learn more about behavioral, cognitive, social, and functional changes that are going to be occurring. There's lots of reading material out there through the Alzheimer's associations that you probably know about. There are a number of different books out there that are available for you. So be aware of the changes that are going to occur, and begin planning for this assistance. Okay. And when you're doing this reading, remember the saying by Mark Twain, be care of reading health books. You may die of a misprint. A little dramatic, but true. So you have to make sure your sources. All right. Take care of that. Develop early on, and these are practical strategies for yourself. Develop your financial plan. Be clear that you have protection if you can get it, how to get protection as soon as possible, what monies or assets may be involved in this process, because you know and you read about that families generally spend totally billions of dollars over the year, and most of it's spent by families because of the cost related to medical changes and lodging and those kinds of things. So look at your legal planning, look at your financial planning. Prepare for medical changes in advance for yourself and your loved ones. Practical strategies really begin with the first diagnosis. Okay. It is important that you recognize that there are going to be these medical changes that are occurring, not only for your loved one, but for yourself. This is going to take a toll. It's going to take a toll in stress. It's going to take a toll physically, sleep changes. There are many different kinds of ways that this disease process will affect you and your loved ones. If you have medical conditions to begin with, understand that you have to take care of yourself first. There's a priority there. And remember, when I say take care of yourself first, it does not mean to the neglect of your loved one. What it means is that if you're not capable of caring for yourself and you are the primary provider of care, your loved one is not safe. Your loved one's not going to receive the care that they need to get. So make sure you are preparing for your self-care. Okay, self-care meaning exercise, medical care, nutrition, sleep, all the things that are necessary to keep you in the position you are. Okay. And again, prepare 6 months to a year ahead. Best thing you can do for yourself. Next slide, please. Now, this slide and a number of the next two slides after this are different. I developed these on papers that I generally hand out at meetings. And I obviously am not meeting with you, and I'm hoping you can look at this and you have access to these slides in the future, since we are recording. And they're basically looking at the cognitive changes that begin to happen, the decline that occurs when a person is going through the dementias. And they generally occur with mild cognitive impairment. And it's just a whole series in a nutshell of these different cognitive changes. The next slide, please. Thank you, Lauren. These are a self-home guide for families with dementia. And basically that means what you can do at home to provide ease, to provide a better care living situation. Okay, to be able to care for your one at home so that you're eliminating or minimizing some of the dangers, some of the ways of communicating, like putting up a little whiteboard where you can list the day's events or the medical appointments. And just different ways to make life, daily life, easier. And the next slide is the communication guides, how to communicate more easily and succinctly as the disease progresses. For example, instead of saying, well, let me ask you a question, and those of you can guess. I will not hear your answers, but here's your guess. If I give you the directions to say, I'd like you to go into the bathroom, brush your teeth, and come back out, how many steps are involved in that? I'll give you a minute to think about that. How many steps are involved when I ask you to go into the bathroom, brush your teeth, and then come back out? Well, generally the answers I get are anywhere from 3 to 6 to 7, maybe 8. Let's break it down. When I ask you to go to the bathroom, you have to know where the bathroom is and how to get there. You have to know, first of all, what a toothbrush is. You have to know what toothpaste is. You have to know what to do with the toothpaste, how to put the toothpaste on the toothbrush, how to brush your teeth, what to do after you brush your teeth, whether it be rinsing or however you do that, what to do when you're done rinsing, using a towel, putting things away, whatever it might be, and then coming out. So my point here for you is that there are a lot of messages in a simple instruction. And what I'd like you to consider and think about in your communication with someone who has mild cognitive impairment or any stage of the dementias is how simplistic can you make the information? Instead of saying, sweetie, are you hungry? Would you like something to eat? Simplify it. Hungry? Thirsty? When you ask questions, and I'm not a fan as the disease progresses of asking too many questions. I make statements. Okay, so instead of asking open-ended questions, an open-ended question is like, how are you today, dear? How are you feeling today? What would you like for dinner tonight? Are you in the mood for breakfast? That could be a yes, no. What would you like for breakfast? Those are all open-ended questions. My suggestion is to not ask them. Stick with either yes or no questions or make statements. For example, would you like chicken or soup for dinner? Would you like to go to the movies or bowling? Do you want to go for a walk? These are very simplistic, and yet they get the message. Cut out the prepositional phrases and all the trimmings that go with your questions, and do not ask open-ended questions. Now, I'm not talking about everyone. I'm talking about those folks who begin to have difficulty with decision-making. The decision-making is a higher order function. Decision-making, insight, judgment. Okay, those are all more difficult for people who are in the middle stages and beyond of the dementia's process. Mild cognitive impairment, early stage Alzheimer's, people can make those kinds of decisions. From Christina, yes, we can get copies of these strategies on the slides. Thanks for asking. I wasn't sure if it would automatically be able to download for you. Thank you, Lauren. Okay, so we're looking at communication guides. How to simplify communication. Because as your loved one gets more frustrated, getting back to something that was mentioned earlier, I think it was by Judith, was apathy. If I do not understand what you're asking me, I tend to become more lethargic, which means less motivated, and apathetic. If I cannot understand the words you're using, if I cannot understand the choices that I might have because it's an open-ended question, how do I answer that? I can't find the words. All these different ways affect communication. Okay. So next slide, please. Looking to the future. You know, I want to talk a little bit about how to, and I know you're here for part of this, you're here for is how to look to the future and how to deal with family members or friends that are maybe difficult. Let's talk about that for a few minutes here. My experience is, let's be honest, every family brings their baggage. Some baggage is heavier than others. And when a person in a family members that still has communication with a group in the family, what generally begins to happen is that old stuff comes up. The bag gets opened. And so, especially when there is residual anger, frustration, sadness, fear in the family system, mixed family systems, you know, that's why you have to decide who you want to share with and who the people that are safe with. So you have people, I've experienced this many times. You may have a son or a daughter who lives in, let's say, Missouri, who hasn't been part of the family very actively, all of a sudden starts throwing in, this is what I want done. This is the way we should treat dad. This is the way we should treat mom. This is what has to happen. These have become very difficult situations. Okay. And you have other situations where siblings have been generally been doing well as adults. But as soon as the roles change, as soon as dad or mom becomes unable and the other parent has to take over and may be a little bit more frail, then you begin to see some of the old sibling stuff comes up. Who's in charge? Who's making the decisions, etc. It's important early on to get some sense of what you want and what your loved one wants. When you have those early meetings with that initial group, my suggestion is to have whoever has the disease, Alzheimer's, whatever kind of dementia, part of those meetings. They're very capable. They're part, no secrets here. Let them talk. Let them hear what's going on. Be honest. State the obvious. Talk about what's going on so people in the family can get a picture while they are still lucid, and then you'll have less challenging as time goes on. So make everyone part of the situation. It won't resolve everything, yet it will help. It'll go towards that direction. Share information regardless of the changes with the people you want to share with. Secrets do not work. There are some people that you do want to share with because they're more intimately involved. They're part of the decision-making process or care process. Those on the outside, you don't have to share all your information. Make those decisions. You're in charge. Whoever the primary care provider is, let the person who is the spokesperson know who they can share with or you share with. Maintain a support system. Do not isolate. Do not isolate. Have your support system. You require that. Have your self-care program. Set it up. Structure is a depression's adversary. If you have structure in your life, you help with your own depression and you help with what you are able to accomplish. So structure your exercise time and structure your free time. What you do with it, how you exercise, how you use your free time is up to you. Schedule it like you would a doctor's appointment. If you do not, you will put it off. You do not want to put it off. So schedule your time appropriately for yourself. Looking to the future again, perseverance. This is not a sprint. This is a pace, sometimes a very slow pace. Roles will change. If your loved one who has the dementia is your spouse, your role will change from husband, wife, loved one to care provider. That produces psychological and emotional changes in you. Remember the basic primary question. What is best for my loved one? It may not be best for you. Is your loved one remaining in the home or in your family's home because you want them there and it may not be the safest place for them? Certainly I cannot answer that. Only you can, honestly. Or maybe some people you trust can help you answer that. Share your changes with your support group, as stated. Allow for flexibility with your decision making. Again, I say there are surprises up ahead for everybody. Changes will occur. Be flexible. Don't knee-jerk response. Emergencies require knee-jerk responses. They require you to act spontaneously. Otherwise, take the breath. I did. I needed it. Take the breath. Consult if you need to, professionals and or others to make decisions. Slow it down if you can, as much as possible. Another reason to think 6 months to a year ahead. Learn. Okay. Use your support group. Find a support group that you can verbally vomit on, excuse the expression, but share what's going on with you. You'd be surprised how helpful it is. I tell people, just as an aside here, talk out loud to yourself. I do all the time, whether I'm in the car, shower, alone, does not matter. Talk out loud to yourself. There's a releasing of energy. If you can't sleep at night, get up, go in another room, talk out loud what's on your mind. Keeping it in that head of yours and going around in that tube, around and around thinking, does not help. When you say it out loud, you hear yourself, you let go of the energy, plus you can decision make. I'm saying the same thing over and over again. Is there anything I can do about this at 2 o'clock in the morning? No. Do I need to make a note for myself so I can remember to make this call? Okay, I'll do that. Give yourself a break. You don't have to pound yourself about what's going on, most of which, if not all, is out of your control. Okay. Maximize potential. People do not recover from Alzheimer's, frontotemporal, Parkinson's, those kinds of dementias, the prefrontal dementias. But maximize potential. Live. Don't wait for death. Live. Enjoy and live life. Okay. Our most upsetting times offer our greatest opportunities. This is not generally, wow, I was so glad. Yet, do yourself and your loved ones and your family and your friends a service. Enjoy life. Maximize the potential. Utilize the skills that we know helps with the disease process. Be a good listener when people have ideas, when they have opinions. You don't automatically have to say no. Thanks for the offer. Thanks for your input. Let me sleep on it. Give me some time. This is tough. Go at your pace. Work with the pressure in your ways. I'm going to leave the rest of the time for comments and questions. Put on the last slide there tells you who I am, my books, and how to contact me.
Yes, thank you so much, Dr. Gelber, for such a wonderful presentation. So much insightful content. Like I said, I will be happy to email out the slides at the end of the presentation. And now, any questions for Dr. Gelber, please feel free to take yourself off mute and ask a question, or you can put it into the chat box. And as Dr. Gelber said, here's all his information if you want to ask him a question directly. I got a quiet group, but it usually takes
It's
just
okay.
one.
It's quite all right.
I have a question.
Thank you.
It's Irene. Go over again the selecting the contact person, and the context I say this in is my sister is diagnosed with she's on Aricept now, and she's totally in denial. And she is married to my husband's brother. So sisters married brothers. So I'm concerned both about my sister and, of course, my husband's brother.
Right.
And I've had lots of experience with this. That family has not. And the brother-in-law is now allowing me to help a bit. So I guess the question is, tell me a little bit more about the diagnosed person. Brother-in-law is not one to ask for help.
Yeah.
But he's the most willing I've ever seen to be open.
Well, yes. And if every family is mostly like my family, is that you listen to information and will receive information better from a professional than from a family member. I could give the same information to when my children were small. I'd say, let's have a family meeting, and they go, oh my gosh, it goes group therapy. And I think what happens is if the doctor says so, we listen more. So one suggestion I have is be able to maybe suggest that so it's your brother-in-law. Oh, no, it's your brother, right? Is to speak to a medical professional or a mental health professional that can give him more information. You can also suggest that he do his own reading. This way he could do it on his own time, and he doesn't have to report to anybody. No one has to know. Give him some suggestions or some leads to maybe the Alzheimer's org website or AO Alzheimer's Orange County website. If they have materials, let him do it at his own pace. Definitely understands and he sees what's going on. The fear that a person has for themselves or their loved one is dramatic. And they really minimize or deny the connection of events that goes on. Okay. The person that has the disease process will be in denial. Denial is a wonderful thing for the short term. But as we know, continued denial causes many, many difficult problems. That's why formal diagnoses, generally are not made professionally. Let me rephrase that. Symptoms are generally there for about a year before a person is diagnosed. because people don't want to deal with it. So it's not unusual, to think what you're going through. I know you're feeling rather helpless. All you can do is supply the opportunity at this point. It sounds like you're going to be a valuable person in their little circle. At this time, you may need to be more patient and allow them to discover as they go along. I hope that helped, Irene.
I have a question if you're ready.
I am.
Oh, my 75-year-old brother, and wife, they live in Northern California. They've not lived together for close to 10 years. My brother's been diagnosed with early dementia, about 6 months ago, and he's been living on his own, for those 10 years. He's been in his community for 54 years.
Mhm.
His wife wants to move him down to Southern California to an assisted living facility,
Mhm.
and he's not ready. He has two caregivers, right? One caregiver that comes in 2 days a week, and that seems to be working out. But I think the wife is burned out and doesn't want to do all the responsibilities that it takes to organize him and get things done. So we are three sisters down here, and we're really nervous about our responsibility legally and emotionally, in that she wants to ship him down here.
Yeah, yeah.
And we just, we're
Good
out of,
question.
it's really hard for us.
Good question. And it's very, yeah, you feel helpless and
Mhm.
unable. A few things. From a legal perspective, uh, does your brother have a POA, designated POA, power of attorney?
His daughter, yes,
Okay.
but
So,
we don't have access to that.
okay. So at this point, as long as he has not been deemed incompetent, as long
Hmm.
as he is competent, he makes his own decisions,
Yeah,
regardless of what his wife says.
yeah,
Okay. So when he becomes incompetent, the POA will make those decisions. If she's the power of attorney for his medical, psychiatric,
yeah,
and so on. His wife will not be making those decisions. His daughter will.
uh-huh,
So as long as wants to stay where he is and is competent to make decisions, does he have a plan? Do you know?
um, well, no, he doesn't. He wants to stay where he is, and I believe the
Okay.
landlady, would like him, she's a retired doctor. She would like him to leave the apartment. So
Okay.
there's a
Well,
push on that end too.
you're not clear about his level of competence at this point, then. You don't see him often, or really, has he been diagnosed and been evaluated to know
Yeah.
where he is in the process?
Well, they've diagnosed him to say that he probably shouldn't be driving anymore.
Mhm.
So they've gone that far with him. But I haven't seen the diagnosis per se. They just said early cognitive memory loss.
Yeah, yeah. You're in a difficult position because you have no power.
Yeah.
And all you can do is, I'm not sure, it gets into the dynamics of the family relationship.
Hmm.
What the dynamics that he has with you. I mean, that's a real, you're presenting a really large situation that needs a
Yeah.
good consultation,
Hmm.
with understanding all the players and how they, fit into this.
Hmm.
At this point, I think is the time to act, because if you wait too much longer, it's going to get testy, to say the least.
Hmm.
If there's a way to have a meeting with all the players, I would.
Yeah.
I would get everybody down in the same room or virtually through a Zoom,
Hmm.
and have a heart-to-heart meeting, including, of course, your brother, and start that process of looking at planning, etc.
Yeah. 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 There have been attempts made, but yeah, I don't want to belabor the point. But thank you so much. I do appreciate exactly that needs to happen. Yeah.
Okay, good,
Okay. Thank you very much.
sure. There were two in front of me and wasn't able to read them, so I'm not sure they're still there.
They are. So, thank you, Dr. Gelbert. When my mom got Alzheimer's FTD, it seems like the family put their head in the sand and didn't want to help or talk about it. So I went through the caregiving journey alone for almost 10 years. My mom's only sister hasn't talked to me since, and my brother in the beginning told me he would stepped up and wanted to help mom, and he was out. I believe a lot of family not stepping up is due to fear and not understanding wanting to understand the disease process and responsibilities. Such a sad and difficult journey, but I was glad to be there for my mom.
You said who wrote this? Thank you very much. You said Alzheimer's and FTD, frontotemporal dementia. I'm not sure if you meant that they have diagnosed both dementias or if it's one or the other, because they are different in their presentation. That's not your question yet. Again, we're talking about the family dynamics that are coming into play here and what the agendas are. If there are people that can get together and talk about this, not knowing the extent of the dementia process and the person you're talking about, is it possible for everyone to get together either virtually or face to face with your loved one and make some decisions about how to proceed? Again, the idea of providing people with information is a lot easier with denial and minimization, as opposed to talking to them directly and saying you should, or you should, do you realize what's going on, etc. Your pace around recognizing and wanting to do something positive is duly noted and appreciated. Theirs is slow. So how do you work with someone who's resistant? Generally, you cannot pound someone who's resistant. They're protecting themselves for whatever reason. So you have to step back because they're not going to change. You have to step back and say, okay, what's another approach I can use that can lessen or circumvent their resistance? Again, you have a difficult family situation. This is the kind of consulting that people like myself and others do to help families in their situation. Not easy. And I'm just pointing out the obvious maybe to you, but I'm letting you know that you're not alone. Another question, please.
Christine, do you have a question?
Yes, I do have a question. My father has dementia. I live very close to him and my mother. I do have other siblings that don't live in the area. I had been telling them about the major neurocognitive disorder diagnosis a while ago, but because they would only see him for an hour and a half during a dinner, maybe
Right.
once or twice a year, they didn't understand the full
Right.
thing, what was scope was going on, even though I gave them sometimes some detailed things and they didn't see it, and they just finally started seeing it.
Right.
It's just very hard to get through to family members who are not around. And my siblings, so my dad's 90, my siblings are in their 70s, and they just say, oh, dad's always been difficult. One thing, he's extremely difficult. My mother, he constantly demands that my mother take him to the bank and to the DMV. He's lost his license. He doesn't have a lot of these privileges that he used to have. I keep telling my mom, we have to not take him to the bank, not take him to the DMV, or do we take him and
Okay.
then allow them to then say, I'm sorry, sir, we'll send you something in the mail, and then it starts all over
Right.
again. It's a
Right.
vicious cycle.
It is. And let me say that it is a difficult situation. The best way you can work with your siblings, I want to rush this a little bit because we're almost out
Yes.
of time, is education.
Okay.
They have to become educated. They're
Yes.
in denial. They don't want to see it. Dad's always been like this. He's been cranky and ornery, blah, 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 blah. But they need education. You can slip them stuff, send them stuff to read, or suggest where they can go. In terms of your mom and dad, their relationship is not something you're going to change. They've been practicing this dance for 103 years. Dad is more forgetful. He's becoming maybe a little bit more paranoid and suspicious. And because he's unable to understand the dynamics involved with care and money, finances, etc. I think it's a great idea to have the bank send statements if they would be very helpful, or mom go out and get statements every week or every 2 weeks. Not sure how often he is going through this cycle. You may want to speak to or have them speak to their medical doctor to look at something that's going to calm him down. He may have some anxiety issues that can be medically treated to slow the process down that way also.
Yeah, we put him on Seroquin, I think it's called
Seroquel.
last
Yeah,
week. Yeah.
Seroquel. Yeah.
He started putting like statues in front of all the doors and
Yeah,
yeah, the paranoia.
if he's becoming delusional, then
Yeah,
you have to worry about safety and
that's what, how do I stress that
violence.
to my mom? Just tell her you have to take these classes. See, the problem is she's there with him.
Yeah, violence and safety are two different things. Safety
Okay,
for your mom, safety for your father, and the potential for violence. Again, you cannot tell her. You have to have the medical
okay,
doctor tell her.
okay. Thank you very much, sir. You have a great day.
Thank you. Do we have time for one more, or are we done?
We have time if anybody else has one more question they'd like to ask. I think there's a reoccurring theme of just
Yeah.
difficulty communicating with families.
Well, thank you all for being there. I know you're out there. I don't see you, but thank you. And you have my contact information if need be. Educate yourself and take care of yourselves, please.